Hi, everybody. This is Shelley Tugas with the Hudson Area Public Library, and we are doing a series of community interviews to keep everybody posted on what's happening during the pandemic. And today we have the United Way and Jessica, and I'm going to let Jessica introduce herself and tell us what she does with United Way.
Thank you so much. I'm Jessica Newman. I grew up in Hudson, so very familiar with the community. I joined United Way St. Croix Valley 2 years ago. My role is as the Community Impact Director, and I work specifically with our 211 program, but have worked with several of our other programs, including our food distribution and our mental health impacts in the community in the last 2 years.
Great. I think most people are now getting familiar with what 211 is because it's been around for a long time now, but some aren't. So can you just tell us briefly about the 211 service?
Absolutely. So 211 has been a service that has been available in our community for a long time, but was underutilized. And so our United Way partnered with United Way Wisconsin to bring the coverage of this service area back to our United Way, as it was previously covered by Greater Twin Cities. And what it is it's a 24-hour, 7 days a week phone line that anyone can call. They can dial 211, or they can dial 877-947-2211 if they have a non-715 area code. And I'll share those numbers again as we go through, but they can call those numbers any time of the day or night, and there will be a live person ready to help them resources in the community, whether they're looking for food supports, looking for supports for a friend or family member, or looking just for some supports for themselves, whether it be mental health, substance use, house cleaning, where to get your taxes done, information, all of it.
Okay, great. How have the response been to 211? What kind of call load are you seeing now that we're kind of in this crisis mode?
Right. So 211, not only do we respond to personal emergencies on a daily basis, but we also respond to our state when it's in need of disaster support. Last summer, when Polk County had the windstorm blowdown, we were able to activate our disaster calls and collect data for our emergency responders at the county level. With COVID, we've been asked to do the same thing, but on a very longer period of time. So starting on March 14th, we activated our disaster line and began taking phone calls regarding COVID, where we could share information that was vetted by the Department of Health Services and CDC. We really want to be a resource for factual information to provide people what they need to dispel rumors that are happening, and get information from everything about signs and symptoms to when is my CARES Act check going to come. We have all of that information. Our call volume has been through the roof. We have had more than 178% increase in our call volume across the state. In our own center in Hudson, our call volume is up over 800%. So it's been a huge increase. That's responding to statewide, but also to our community specifically. So we really joined hands with the other centers across the state and responded to the need and been able to provide help for folks. Lots of times a COVID call may come in as I'm looking for or I may have been infected at work, or I'm off because of what's happening and what are the supports in my community, because I've never been in that situation before.
What is the top topic that people are calling about? Is it food? Is it financial resources?
Yeah, so our top topics are COVID has been one of our largest topics in the last 6 weeks with a range of things. But then what we're finding, which is what's really interesting, is that our top calls have remained the same as before COVID. They're rent assistance, utility assistance, shelter, and food. So our top calls really are right in those areas, and they've remained consistent. I think that there's just more people experiencing need now.
Okay. Tell me about the ALICE threshold and what that means during this time.
Yeah, so ALICE is an acronym for Asset Limited, Income Constrained, but Employed. So when we think about people in need in our community, often we think about people who are living below the poverty line and are using other sorts of public benefits. But what we have found through working with partners at United Way and university research, we've found that there is a percentage of folks that are living paycheck to paycheck, and they fall in that asset limited, income constrained, but they're employed. And so they may be living on the edge where they can make ends meet this month for rent and food, but all it takes is one little disaster of having to repair your car with a bill of $200 or more, having the loss of a job, or a child gets sick unexpectedly where you had to take off work. Those things can throw their finances completely out of whack to the point that they really have trouble recovering from that, because their budgets are so tight that they're not able to save and support a cushion for themselves. They're really just that working poor is what we've previously referred to them as. These are folks that are child caregivers. They're working 2 or 3 jobs to make ends meet. When we look at what the average income needs to be in St. Croix County for a family of 4, they need to be making around $70 an hour between both couples, which is just, it's incredible to have that as an income when you look at what the job market is in the area for folks. So to reach that threshold, you need to have multiple forms of income. And if you are a single adult family where it's one adult supporting children, that makes it nearly impossible to get to a point where you can successfully fulfill all your bills.
Mm-hmm. And so the impact of the pandemic, is it greater on that population, or are you really finding that from low income to high income, the same stressors are there?
I think that there's the stress right now is incredible for everyone. But what we are finding is that people that were on the edge of secure have been pushed way off of secure. And they may not be, the other part too is when we say employed, it may be our senior population too that is trying to make ends meet. So it doesn't mean that there's an age limit on our ALICE population. We measure that across the age gap. So in St. Croix County, our poverty level runs about, I want to say 11%.
Okay.
And the ALICE threshold is about 20% in our county. So you're looking at 1/3 of our county. You know, when you look at your street where you live, pick out 1/3 of the households of them that are experiencing challenges in income that have pushed them to a point of needing supports that we're able to provide in our community.
Mm-hmm. And
I apologize.
Oh, go ahead.
I just want to correct my facts there for you. In St. Croix County, we had in 2016, we had 6% of the households living in poverty and 25% of the households living in that ALICE threshold. So getting to about that 1/3.
Okay. What about mental health? I mean, even, you know, if you still have your job and your family is healthy right now and your kids are home doing homeschooling, you know, people in the ideal situation right now are really struggling with isolation and being trapped with their family. What are you hearing in the phone calls, and what would you recommend people do if they do need help?
Right. So those are great questions. What we have seen in our phone calls has been a change over the period of time that we've been in this pandemic crisis. In the first part of the crisis, really our calls were between 5 and 11 minutes, and they're looking for that factual information because we were all thinking it was going to be short term. But the longer that this has gone on, our phone calls are now stretching into the 12, 20, 25, and 30-minute mark, because people need someone to talk to. They need that warm support saying, this is what's happening in my life right now. I'm not sure how I'm going to handle it. When people call 211, they share with us everything. The great thing about 211 is that it is anonymous, 100% anonymous. So we're here to provide support. But you can keep that anonymity, but we also can provide some supports as well to make sure you're getting the help that you need. So we provide that warm line, that hopeful voice that says, you're doing a great job. Here's your next steps to help you get going on that way. We also are able to provide some other supports of professional warm lines that are there just to listen and support individuals in mental health and substance use challenges. So we're providing that support in a short term, and we're also able to provide other connections to supports that can be longer term, whether it is a warm line, a support group, accessing a mental health professional. We're able to give supports for all of that. Some of the things that folks can do, though, for themselves, I think that was part of your question as well, is that we really need to think about self-care, especially in this time. Make sure that we are being gracious with each other, taking moments for ourselves. I know I have kids at home, and I'm a homeschool teacher, a quarantine teacher for the first time, and it is stressful for all of us. So if we acknowledge that it is stressful for all of us, give ourselves grace and not maybe be able to take some time for ourselves, even if it's just 5 minutes to go sit in a separate room by yourself to really just calm down and bring that peace back to any situation, to understand that we're all stressed out, and can be helpful.
Yeah. I had a phone call with a friend last week. Just to get privacy, she had to go into her car. It's very strange. There's just like, there's no escape. So, I think the main concern is if you couldn't afford mental health support before this, certainly struggling now to find those resources and make them accessible to people who don't either have any insurance or have high deductibles or limits on the services they're able to access. So somebody in that position could call and you might be able to point them in some directions that could help.
Absolutely. I think the great about 211 is not only give you the phone number for the resource that we're connecting to, but we talk about what might be some barriers. So we collect information not only on the phone numbers, but the hours that they're available for service and what types of payment they receive. We also have folks that are there to help you get connected to resources that if you may not have insurance, or you're just away, or you're not your insurance cover it, we can connect people who know the systems really well and can help you get connected to those resources that can help the payment supports or reduced cost services as well.
Okay. What can members of the community do right now to help each other using United Way, sort of the connection?
Yeah, absolutely. So you can always go to volunteerwisconsin.org, and that's where we've encouraged our partner nonprofits as well as ourselves to list our volunteer opportunities. So it's volunteerwisconsin.org, and then you can search by county, and you're able to find the needs that nonprofits are having right now from a volunteer perspective. We always are looking for volunteers who want to help out on the phones for 211. It is an extensive training, but what you're able to do is really provide that warm voice. We have a database that's curated, so qualifications are not that you need to know all the resources. You just need to be willing to extend an open ear, listen to someone, and help connect them with the information that we have. So we're looking for volunteers. Food distributions that we work on, United Way on a monthly basis prior to COVID provides support to 25 food pantries and shelters in Pierce, St. Croix, and Polk County. What we have done in response to that is ramped up our efforts. We are providing more fresh produce, more staples to these pantries, knowing that they're going to have an increased need. Additionally, we've put out some emergency bags to frontline workers, whether it's village folks, police, fire, EMTs, hospitals, to let them know that if they're encountering folks that don't have any food in the house, they do have an emergency bag that they can hand them. That bag also includes information about 211, where they could get connected with other resources or just their general food pantry. In addition to that, we're working on how do we address upcoming food challenges that are going to be happening in our community as schools wind down and summer school not be happening. So with our volunteer efforts on Volunteer Wisconsin, you can find out where we have a need to help support that. Because putting together emergency bags of food and getting food to our food pantry takes a lot of folks to make that happen.
Right. I've also learned that, food donations are wonderful, of course, but what you can do with cash is incredible. compared to actually just getting perishable, non-perishable items. So tell me a little bit about that.
Right, yeah. So when folks give funds for food purchasing, we're able to turn $1 into $8 of food. So for every $1 you give us, that equals $8 of food, whereas if you give us a can that's worth 99 cents, it really only retains that value at 99 cents, and we can only give the one can of food to the food pantry. So we're really able to work with our distributors in a buying power, because we do buy for countries and shelters, to really expand and capitalize on the donations that we're giving. So you can donate at unitedway.org to help our food supports, also to help our 211 resources, get connected with folks that if you want to provide supports for families that are in need of rent or utility assistance, you can connect with us that way too. You can always get connected by calling 211. Additionally, we can help find volunteer resources as well, or folks or organizations that are needing donations.
Wonderful. Anything I didn't cover that you might want to talk about?
You know, I want to correct one fact. Sorry. I shared that earlier, the survival budget for an Alice household, the household budget for 2 adults and 2 children is $34 an hour in St. Croix County.
Okay.
So not 70, I apologize for that, but that's still looking at when you're trying to put together jobs that are maybe between $12 and $15 an hour, you're still looking at least 2 full-time jobs to reach that point. And sometimes it's less than that for folks. So we want to make sure that we're for them to support them. So we're grateful for the community. Our community is incredibly giving and supportive, and we're grateful for the work that they do, that you do, getting information out. And we're here to help connect everyone. So they can give us a call anytime.
Well, thank you so much. I appreciate your time today. I know how busy you guys are right now, and we really appreciate what you're doing for our community.
Oh, thank you so much.